Autonomic nervous system dysfunction is extremely prevalent in our society, and it causes a host of symptoms that sometimes may not seem related, but they are, and everything from dizziness to digestive issues. And a lot of that comes because your system can't regulate to changes of where you are in space and changing positions. Fortunately, there's this excellent test that helps to give us that information that your body responds to these different positionals. It's called a Nerve Express, and one of the things we do is we use a heart strap here, and we put it on there, and we have you change positions. We have you go from laying down to standing up to holding your breath to deep breathing. And after the test is completed, we get these really nice graphs, and you'll see over here behind me. This is one of a couple of graphs that we look at, we can interpret. This one's going to be a little bit easier for us to understand here. Your parasympathetic nervous system and your sympathetic nervous system. The parasympathetic is your rest and digest, and then the sympathetic is going to be your fight or flight. And so we need to have a nice balance between these two. In this case, you'll see a green dot and you'll see a light blue dot. The light blue dot is supine, and the green dot is being upright. Supine just means you're laying flat on your back. When you're laying flat on your back, your body should be at a state of rest. This is where you sleep. This is where your system rests and recover. So in that case, your parasympathetics should be increased and your sympathetic tone should be decreased. So we should see something over here about a 4 and a 1. And then when you stand up, there's a change, and the blood vessels should constrict to make sure you keep blood going up to your head, and that the receptors up there can regulate and say, hey, yeah, we're now standing up and we have enough blood supply and perfusion up to the brain. In that case, the parasympathetic should turn down, the sympathetic should turn up. So we should see a nice diagonal line going from about right here where this arrow is, up right through here. But you can see in this individual, when they're upright, let's start with it. When they're laying down, their parasympathetics are in the negative zone and their sympathetics are extremely high. So they're having a paradoxical reaction. So their body can't get into a state of rest when they're laying down. And then when you can see when they go upright, which is the green dot, their parasympathetics actually turn on and their sympathetics disengage just a slight bit. So basically, their level of adaptability is really, really, really low. And this person has a reaction that there's just not an appropriate reaction. So they're going to have difficulty knowing where they are in space and lightheadedness, because their body isn't going to be able to acclimate to where it should be in the changes of position. So knowing this patient, they do not like going on roller coasters because those quick turns, sideways, up and downs, their body just can't acclimate to those. So testing this allows us to get an insight of where we need to improve function. And tests like this, so we can help to improve the function of this by having you change positions, directing inputs into the brain with colors, senses, vibrations, specific movements. We may even be able to help improve stuff with breath work, and so getting your body to know how to respond by deep breathing, shallow breathing, and then we couple in breath work and movements. So this test is excellent for letting us know how your body responds. If you or one of your loved ones happens to have an autonomic nervous system dysfunction and you'd like to have this test, please give me a call and let me know if this is something I can help you with. I'm Dr. Leonette.